Cindy in Jeffersonville, in Sullivan County, asks, do I support defunding Planned Parenthood of America, and would you consider defunding the abortion part of Planned Parenthood? I've felt that the defunding effort of Planned Parenthood in the Affordable Care Act revision, in that reform legislation, was not a wise thing to do. That's still my position. I do not support use of tax dollars to pay for abortion, and Planned Parenthood now is prohibited from using tax dollars to pay for abortion. And just a few weeks ago, I voted in favor of legislation which would take the Hyde Amendment, which prohibits the annual appropriation of funds from being used to pay for abortion. It would prohibit federal funds from being used for this purpose and put that in statutory law. I would note we're all New Yorkers, and New York State does use public dollars to pay for abortion, and that's something that has been a long-standing provision in state law. When I was in the state legislature, I opposed that, but that's not what the majority has voted and the majority believes. So that's our state law, but federal law has long precluded such funding. Jennifer in Ghent, we have crumbling bridges, roads, and airport. How can we afford to pay for these crucial infrastructure needs and pay for the Great Wall? Very good question, Jennifer. I'm on the Transportation and Infrastructure Committee. I'm concerned about and also the Budget Committee, I'm concerned about making sure our expenditures are wise and thoughtful and prudent. There is also already, I would point out, on the Mexican-Texas and Mexican-Arizona and California-New Mexico borders, there is a wall in many parts of the border. There are other parts where a wall is not practical. And so I'm going to insist, from my vantage point, that we have proper border security, but not build a wall where a wall would not be prudent or efficient. Carol, I think it's Dr. Carol. So Carol is a healthcare practitioner from West Shokan in Ulster County. Concerns about the ACA as a healthcare practitioner and someone who's been self-employed for 30 years. Why is there such a rush to push this legislation through? This is so important. It should be an informed decision, and the rush does not allow us to process the multiple aspects of this. I'll tell you this, Carol, very good question. Actually, this is not being rushed, but there are definitely things that we have to do. The ACA in many parts of the country, particularly the insurance aspects of the ACA, is collapsing. Insurers are pulling out of markets in many states. There are over 1,000 counties in America where there's only one choice of health insurer. And this is becoming more acute. Many of the large insurers are pulling out of the insurance markets, in part because of the regulatory structure that's been set up in the ACA. It over-federalized this issue, whereas states have long had the expertise and the ability to adjust to market conditions within the 50 states. But the ACA federalized it and really superseded state control in many areas. So I think that's the issue. If we were to sit back and do nothing, the ACA would collapse in many parts of the country, the exchanges would collapse, and people would be worse off. So, this is controversial. I know it's controversial. I know that ultimately, though, people are going to be happy with changes and people will be unhappy with changes. But I'm telling you, as a representative, as a member of Congress, I think it's my responsibility not just to sit back and watch a unfolding disaster. My responsibility is to try to fix it. And I've said all along what I want to do with the ACA, keep the pieces that work and fix the things that don't work. Some of my colleagues want to just junk the whole thing and be done with it. Some of them want to toss it out and not give a transition. I don't agree with that. I fought for a adequate transition so that states like New York that expanded its Medicaid population, that we have a reasonable period of time, and this would be through 2019, anyone that's in that Medicaid expansion would be able to stay, and the state would still receive enhanced funding for those people that had received Medicaid through the expansion. And we also are working hard to try to make sure that the state has an adequate source of revenue going forward to deal with the Medicaid population. We have over 6.2 million people in New York State out of 19 million total on Medicaid. 6.2 million out of 19 million. Candidly, I'd like to get a lot of those folks into private insurance. I'm hopeful that the advanced refundable tax credits that are being offered and the new flexibility that the state has, plus the state incentive grants and state incentive fund, will provide the opportunity for New York to fashion a Medicaid system which works best for us, not having to come to Washington every time they want to adjust their program. New York actually has a very astute and smart Medicaid administrator in the Department of Health, and I'm confident that with additional flexibility he could improve our system. But we also have tremendous waste and fraud in our Medicaid system, and every single year we hear stories of prosecutors who are bringing cases against people that are ripping off the system. In New York State, Medicaid is an over $60 billion system. Half of that's federal money and the rest of it is state and local money, and as I mentioned earlier, I'm working hard to eliminate that ability of New York to foist those costs onto the counties. So there's not a rush, but there's a need to fix it, and that's what I think is really important. Carol, I thank you for your service. Lance and Joanne in Monticello, talking about the fines under Obamacare, and that they were fined, obviously, because they didn't buy the insurance, and there are many people in Sullivan County who get free services. When are the hardworking people going to be helped? Well, this goes to the heart of one of the issues in the individual healthcare market. Some of my more conservative Republican colleagues have objected to the advanced refundable tax credits that are being offered under the healthcare reform legislation. I support those tax credits. I think they're a critical component of bringing equity and fairness into the healthcare system. Today, about 170 million Americans get their healthcare through their employer. They're in employer-sponsored plans. This has been the case, and predominantly the case, since World War II. Well, those Americans that receive healthcare through their employer don't have to pay taxes on that benefit. That is a subsidy under the tax code to encourage employers to provide health insurance to their employees. So the 170 million Americans that receive health care through their employees, they may not realize it, but they're actually getting a tax subsidy because that benefit is not taxable to the individual employee. However, what if you work for an employer who doesn't provide health insurance? You receive no tax subsidy, no tax benefit whatsoever. In fact, you would have to have healthcare expenses more than 10% of your adjusted gross income in order to even deduct those costs. But if you're someone who's making $40,000 or $50,000 a year, a deduction isn't going to help you. So the proposal in front of us in Congress now would create an advance refundable tax credit. And this simply means it's advance, which you get it up front. You can take that piece of paper that says you're eligible for a tax credit of a certain amount to a health plan, and they can basically treat it as cash. And you get that ability to take that advance credit to an insurer, and the insurer can basically use that as cash to provide you insurance. You'll have to pay some part of it, obviously, but the advanced refundable tax credit will expand by age so that people who are older, who have higher healthcare costs, will be able to get a higher amount. So a family, for instance, it would range between $4,000 for a married couple up to $14,000, depending on the number of children they have. So this is the advantage of these advanced refundable tax credits. The fundamental thing it does, though, is finally addresses and redresses the problem of people who don't have employer-provided health insurance. They are just basically cast adrift in the individual market. The ACA actually has helped a lot of those people get insurance, but the insurance is often not affordable because deductibles are too high. I've heard numerous stories from people, small businesses and employees who work for those businesses, who tell me that their premiums have doubled in the last 5 years and their deductibles are $5,000 to $6,000 to $7,000. That means they may have insurance, but they don't have insurance they could actually afford. So the idea is to, with insurance regulatory reform, bring down the costs of insurance, bring down the costs of premiums, protect those that have pre-existing conditions, keep those kids on 26, up to 26, being able to stay on their parents' health plan, but most importantly, provide that coverage for people in that individual market who don't have employer-provided health insurance. That's what we're trying to do with this, and that's what I'm hoping we can accomplish. I'm still going through the legislation with a fine-tooth comb, going through the CBO forecast in terms of costs and benefits, and we'll make a decision later this week. I think we'll have to vote on this in the Budget Committee on Thursday. But I surely appreciate everyone who tuned into our Facebook today and to our town hall last night, and I'm hopeful to hear from more folks on this issue, and I know I probably will going forward. Thanks so much. Stay out of the snow, be safe, and we'll see you next time.